Hey guys, if you've never had dry needling done and you're interested about it, check out this video. My name is Dr. Adam Duress. I'm going to go over 5 of the most common questions we get regarding dry needling. The first question, what is dry needling? So dry needling is simply just whoever is doing the needling, just putting the needle into a muscle, trigger point, ligament, whatever we're trying to target at the time. It's simply just that process of inserting it. Number 2, how does dry needling work? Well, when we put the needle in, it causes a small lesion in the tissue, which is what we're trying to do. And then it causes a very small pro-inflammatory response to occur in that tissue, and it gets a lot of blood to the area, brings a lot of good nutrients in, and gets that healing cascade to occur in the tissue. And that's how we really get a lot of healing done, is causing that small damage to the tissue. 3, is dry needling the same as acupuncture? Not exactly. There are some similarities. The needles are very similar themselves, but the way that we determine placement is different. Acupuncture is rooted in Eastern medicine, so they focus on meridians in the body. They are trying to restore flow in the body, versus dry needling, we're trying to basically get rid of trigger points. So I determine a lot of my needle placement on feel. If I feel a trigger point, it's recreating pain, then I'm going to try to get rid of that trigger point. So dry needling also goes to a deeper depth than acupuncture. So we really get into the tissue. Acupuncture is a bit more superficial. Number 4, is dry needling safe? Are there any side effects? It's very safe. There are very few side effects. The most common that we see may be a little bit of bruising at the needle site, or just soreness, like usually the day of, or maybe the day after being needled. I know myself personally, I'm typically sore the day I am needled, and then by the next day it feels quite good. So it's done its job. And then the final question, number 5, is it painful? We get this all the time, and unfortunately I can't say yes or no. It's very relative to the person. I'll share my experience. When I've been needled, I've had some that have been a little painful and some that I don't even feel. Typically, I'll feel the little pinprick when it goes in, and then once the needle's in place for 10 seconds, I hardly even know it's there. If there is a good trigger point, I've had some that have ached a little bit for 20 to 30 seconds. It kind of feels like a dull toothache almost, and then it goes away. But I find it to be quite comfortable, and I know most of my patients have as well. So if you think dry needling might be an option for you, give us a call. We can check it out. In our next video, we're going to go over some different techniques we do when needling, including electric stimulation and some other manipulation we do with the needles. So stick around, listen to that, and we're going to have dry needling videos all month, so be on the lookout for that.